You have endometriosis.
I do.
Ladies coming to me in severe pain, being investigated, laparoscopy, removed some scar tissue.
They removed what they could see. I think it was ablation. They found it had grown out of my uterus and towards my bowel, put in an IUD, so hopefully the hormones and that should stop it growing.
Your job is midwife. The endometrium is the lining of the womb.
It is.
These cells can shed and travel to other parts of the body.
It goes out through the endometrial lining to the outer layer and then further on.
And even into the lymph nodes. Is that those uterine cells shed blood, and the pain is excruciating, isn't it? Some people, it makes them sick and quite nauseous.
Yeah, that I used to get awful migraines with it as well.
Poor thing. We need more research, don't we?
We do.
Do you know of any research going on?
I do. There's a couple of consultants at the hospital I actually work at who specialise in endometriosis, and there's a whole new way that they're actually looking at finding that women have it instead of having to do the surgery. It's like a pad that you put over your pelvis, puts electric waves or something through you, decipher from the readings if you have endometriosis or not.
But what we really need to know is why.
Yeah.
Why do those cells travel?
Yeah, why does it happen?
Difficult to get pregnant?
Yeah, it blocks fallopian tubes. Your lining doesn't thin and thicken as it should, so it makes it less likely for an egg to implant.
Sophie, you've come all the way from Swindon way.
Yeah.
And you have been twice before.
I have.
So you had reflexology, core therapy.
Sounds about right. And I think first time I came I had a massage.
Did you?
I think, yeah.
Okay, so you've had a bit of everything.
Yeah.
You're back today for core therapy.
Yes.
And then you might have a little reflex as well.
That'd be lovely.
Okay. And I remember when we talked last time, you said that you were suffering a little bit with periods.
Yeah.
And you've since found out you have endometriosis.
I do.
So this is a recurrent theme with my channel. Unfortunately, ladies coming to me in severe pain, and I say, have you had a laparoscopy? Have you been investigated?
Yeah.
And you have done
I have,
now.
yes.
So they did find it. They removed some scar tissue.
They removed what they could see. I think it was ablation. They found it had grown out of my uterus and towards my bowel. But they got rid of that and then they put in an IUD, so hopefully the hormones and that should stop it growing as much as it was.
Oh, is that right?
That's the idea, yeah.
So putting an IUD in will just balance out the hormones a bit because they think that it's the hormones causing the endo.
Yep.
And of course, you know this more than anyone because your job is midwife.
Yes.
But the endometrium is the lining of the womb.
It is.
And for some reason that we are yet to find out, these cells can shed and travel to other parts of the body.
Yes.
You'd think it would just go within the fallopian tubes and the ovaries, but actually it can.
It can grow out, it grows out through the endometrial lining to the outer layer and then further on.
And even into the lymph nodes.
Yeah. It can go a bit of everywhere. In the pelvis, generally. It's rare that it stretches out, but generally in the pelvis.
I've had the odd client that's gone up to the lungs.
Oh, wow.
Even into the shoulders, into muscle tissue.
Oh, bless them.
Yeah.
Gosh. I don't think I'm that level.
No.
Luckily.
Yes.
They found it at the point
But
they did.
think of the pain. So what happens then with every period, every monthly period, is that those uterine cells shed blood. So wherever they are in the body, they will shed. And the pain is excruciating, isn't it?
Yeah, it's a lot.
Some people, it makes them sick and quite nauseous.
Yeah.
Yeah.
Mine was a fair bit of that. I used to get awful migraines with it as well, but I think that was the hormonal imbalance along with everything. And then it would just the pain, I wouldn't be able to, I'd have to have days off work because it was that bad.
Yeah.
So at the time it was not ideal, but I've been a bit better since, so.
Any migraines since?
No, actually, which is good.
Good.
Because I'm not having I think it was maybe down to that all the pain. It would just kind of part and parcel with it all.
Yeah. Oh, poor thing.
Yeah. It's all right though.
We need more research, don't we?
We do. Yeah, there's not much in it at all, actually.
Are you, I mean, you're sort of in the industry. Do you know of any research going on?
I do. There's a couple of consultants at the hospital I actually work at who specialise in endometriosis, and there's a whole new way that they're actually looking at finding that women have it instead of having to do the surgery. And it's the idea, it's almost like it's like a pad that you put over your pelvis. I think you have to have it on for about an hour, something along those lines. The only thing is this is only in the private sector at the moment. I know it's not public or through NHS, and you put this pad on and it basically puts electric waves or something through you, and then they can decipher from the readings if you have endometriosis or not. instead of having to do the surgery to find it.
Okay.
Which was something I was talking to one of the consultants the other day about it.
Okay.
Sounds interesting.
Excellent. So
less invasive.
Yes. Although from what I've seen with clients, whether this is true or not, those clients that get to the stage of needing surgery or investigation probably do have endometriosis.
Yeah. It's a lot more common than people think.
But what we really need to know is why.
Yeah. It's so difficult.
Why do those cells travel?
Yeah, why does it happen?
You know, and then we can think about how can we stop that happening.
Yeah, it's so true. I've always had an interesting thought, and I was going to do possibly a master's in it, actually, in regards to, because I've now got endometriosis, I also have polycystic ovarian syndrome.
Yeah.
So I was going to kind of see how those would affect pregnancy going forward and whether it puts women at high risk of bleeding.
Yeah.
When postnatally and that sort of thing, because I find it quite interesting, the idea of it. But the irony is, the only way to actually cure endometriosis is to get pregnant.
Yeah.
So it's a very...
And it's difficult to get pregnant.
It's difficult to get pregnant if you've got it. So it's all
Why is this? Because it blocks this...
Because your lining...
fallopian tubes?
Yeah, it blocks fallopian tubes. Your lining doesn't thin and thicken as it should. So it makes it less likely for an egg to implant, is the idea.
Right.
Yeah.
Oh, okay.
And a lot of the time endometriosis does come with PCOS.
Yes.
And it's the PCOS means you're not releasing as many eggs, and it all just kind of spirals from that.
Oh, interesting. Yeah. Okay. So in hospital where you work, you've helped ladies give birth who have had or have endometriosis and PCOS, and they have perfectly normal,
very normal
healthy
births. Yeah, providing
births.
Babies normally, it doesn't normally affect the actual pregnancy itself, and actually, as I said, it tends to help their symptoms, ironically, throughout the pregnancy.
Because it sort of cleans them?
I think it's just the idea, because the egg's implanted and the hormone that's being produced when you've got the placenta growing means that it stops the endometrial lining from growing as much as it was.
Oh, okay.
So therefore it can't shed and travel. And
and baby is healthy?
Healthy, yeah.
Yeah, lovely.
Yeah, it doesn't
Do you
affect
know
baby.
if there's any research into whether a mother that has endo has more chance of a daughter having endo as well?
I actually don't know. It'd be very interesting to find out.
I don't know if it's genetic.
No, I don't know if it is. I know that my grandmother had endometriosis.
That's amazing. She was diagnosed.
I know. She had it quite severely. Yeah, my nana, I think it was quite late in life she had it. She ended up having to have a hysterectomy because it was really bad.
Really?
But my mum was absolutely fine. And never had any gynecological issues in that way.
Wow,
so
okay.
It's quite interesting. I'd be intrigued to know, but no, nothing that I know of.
I haven't heard it is, but
no.
it's a question.
It'd be intriguing to find out.
Yeah. So, how are you today?
I'm feeling quite well today. I've got quite bad lower back pain.
Because?
When I had my endo surgery, I've always had that kind of lower back spasms ever since I was 16. I injured myself, and it occasionally comes and goes. And when I had my surgery, they had to put my legs up in stirrups at one point, and that just sent my back into complete spasm.
Oh.
So it's been a lot better since, because that was, 6 months ago now? Maybe a bit less.
Okay.
It's a lot better now, but I still get quite bad back pain, especially without work. I'm constantly having to bend over, move into different positions.
Yeah, of course.
And that sort of thing. I try to protect myself where I can, but it's not always the easiest.
So when you say lower back, whereabouts?
Sort of this side, here and here. Just above buttocks, sort of.
Lumbar.
Lumbar, yeah.
Yeah, okay, right. I'll check it out. I've seen a lot recently of the shape of ladies' backs where they have a lovely, because we're supposed to be nice and shaped.
Yep.
We have a lovely shape to the sacrum and the glutes, and then there's like a hinge point at the base of the lumbar and the top of the sacrum, because the sacrum is quite rounded, and then the lumbar can be quite flat, and it creates this sort of line here.
Almost be like a weak point, wouldn't it?
And I feel that there's a lot of pain. I'm almost sensing it when I have my hands there, particularly in core therapy doing tweenar, the rocking. I can feel that tension. It's almost like there's two arrows and it's pointing to the pain.
Here's where it will be.
Yeah. So you've pointed exactly to that place. So we'll have a look.
Could be.
Anything else going on?
Generally, legs are alright. Digestive-wise, it's always a bit 50-50 because of the endometriosis. I've always had my digestion's either great or not that great. At the moment, it's okay, but comes and goes and how good it is.
Yeah.
Generally, I always get a lot of tension in my jaw and my neck.
Right.
But that's from a lot of hunching over at work, and I do grind my teeth when I sleep, I've been told recently. So.
Okay, yeah, all right. Well, core therapy, like you'll have known last time you were here, checks out the jaw, it checks out the neck and the shoulders. So it will soon, very early on in the treatment, tell me if that needs some attention.
Amazing.
Anything else?
I think I'm okay otherwise.
You haven't got a headache today?
No, I don't.
Good.
Which is lovely.
Okay, let's give you a nice call.
Perfect, thank you.